Coronavirus disease, also known as COVID-19, is an infectious disease caused by a virus called SARS-CoV-2. The disease was first identified in Wuhan, China in December 2019 and has since spread globally, leading to a pandemic. COVID-19 is primarily spread through respiratory droplets from an infected person's cough or sneeze, as well as through contact with contaminated surfaces. The symptoms of coronavirus disease, COVID-19, can vary from person to person, and some people may experience no symptoms at all. However, some common symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. The coronavirus disease, COVID-19, is caused by a virus called SARS-CoV-2. The virus is primarily spread through respiratory droplets when an infected person talks, coughs, or sneezes. The virus can also spread by touching a surface or object contaminated with the virus and then touching the mouth, nose, or eyes. The SARS-CoV-2 virus belongs to a family of viruses known as coronaviruses. Other coronaviruses can cause illnesses ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. The exact origin of the SARS-CoV-2 virus is still under investigation, but it's believed to have originated in animals, possibly bats, before being transmitted to humans. The virus was first identified in Wuhan, China in December 2019 and has since spread globally, leading to a pandemic. Preventative measures such as wearing masks, practicing good hand hygiene, and social distancing can help prevent the spread of the virus. Vaccines are also available and have been shown to be highly effective in reducing the risk of severe illness, hospitalization, and death. Testing for coronavirus disease, COVID-19, involves detecting the presence of the SARS-CoV-2 virus in a person's body. There are several types of COVID-19 tests available, including PCR, polymerase chain reaction, tests. This test involves collecting a swab from the nose or throat, and it is currently the most accurate and reliable test for COVID-19. PCR tests detect the genetic material of the virus and can diagnose an active infection. Antigen tests. These tests are similar to PCR tests, but they detect specific proteins on the surface of the virus. Antigen tests are less accurate than PCR tests but can provide rapid results in as little as 15 minutes. Antibody tests. These tests detect the presence of antibodies that the body produces in response to an infection. Antibody tests are not used to diagnose an active infection but can indicate whether a person has previously been infected with the virus. Preventative measures for coronavirus disease, COVID-19, include vaccination. Getting vaccinated is one of the most effective ways to prevent COVID-19. Vaccines have been shown to be highly effective in reducing the risk of severe illness, hospitalization, and death. Wearing masks. Masks can help prevent the spread of COVID-19 by blocking respiratory droplets that may contain the virus. It's recommended to wear masks in indoor public settings and crowded outdoor settings, especially if you are not vaccinated. Practicing good hand hygiene. Regularly washing your hands with soap and water for at least 20 seconds can help prevent the spread of the virus. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Social distancing. Staying at least 6 feet, about 2 arms length, away from others can help prevent the spread of the virus, especially in indoor public settings. Avoiding large gatherings. Crowded gatherings increase the risk of COVID-19 transmission, so it's important to avoid large gatherings, especially if you are not vaccinated. Staying home when sick. If you are experiencing COVID-19 symptoms or have been in close contact with someone who has COVID-19, it's important to stay home and avoid contact with others to prevent the spread of the virus. The treatment of coronavirus disease, COVID-19, depends on the severity of the symptoms and whether a person has any underlying health conditions. Most people with COVID-19 experience mild to moderate symptoms and can recover at home with self-care measures such as rest, hydration, and over-the-counter medications for fever and pain. For people with more severe symptoms, hospitalization may be necessary, and treatments may include oxygen therapy. Some people with COVID-19 experience difficulty breathing and require supplemental oxygen to help them breathe. Medications. There are several medications that have been authorized by regulatory agencies for emergency use in treating COVID-19, such as remdesivir, dexamethasone, and monoclonal antibodies. These medications are typically used for people with severe COVID-19 symptoms. Supportive care: in addition to medications, people with severe COVID-19 may require other supportive care measures such as intravenous fluids, mechanical ventilation, or extracorporeal membrane oxygenation (ECMO), in the most severe cases.